Hi everyone, welcome to our presentation about scapulohumeral rhythm. Scapulohumeral rhythm is the coordination of movement between scapula, humerus, and clavicle during arm elevation. The rhythm is essential because it provides greater full range of motion and maintains stability and reduce impingement.
Focusing on the sternoclavicular joint. Firstly, sternoclavicular joint allows 6 movements. It's up, elevation, depression, rotation, retraction, protraction, anterior and posterior.
So the clavicular joint involves the clavicle bone, and then the sternoclavicular joint involves the clavicle and the sternum. So when you are moving, this joint allows you to move at all different planes of motion, which are surgical, frontal, and
the scapulothoracic joint is a joint that plays a crucial role in the scapulohumeral rhythm by coordinating the scapular motion with the humeral motion so that the arm can move fully and efficiently overhead. It assists in an upward rotation of the scapula. To maintain the glenoid fossa facing upward to support the humeral head, preventing impingement.
So the scapulothoracic joint, it has a force coupled with the glenohumeral joint. So that means about 1/3 of the total overhead motion comes from the scapula, which is roughly 60 degrees of scapular motion to 120 degrees of humerus motion. So in that is a classic 2:1 ratio. The second one is that it maintains muscle tension, which means that it keeps the rotator cuff and the deltoid fiber in optimal position for force production.
So on to another joint, which is acromyoclavicular joint, also known as the AC joint. In here, we're going to do a kinematics of it. So this does allow motions of tripping, which is upwards and downward rotation. Moving on to a horizontal plane and moving on to a sagittal one. Those are the three motions of plane. These functional movement help the scapula and the humerus and maintain feeling with the posterior thoracic side view of it.
We have the glenohumeral joint. The glenohumeral joint is enclosed by the glenoid fossa and the humerus. So with the glenoid joint, it also plays a role in stabilizing the arm during arm elevation. So if you are able to raise your arm for long periods of time, it is because of the glenoid labrum located inside the glenohumeral joint. It has a 50% depth, allowing more stabilization, and it is enclosed by an underlying structure called the acromial arch. Thank you.